In mental health, we're always unraveling really complex situations. And so as I listen to Jodi's story, I'm thinking about the amount of support she needed and then got. I'm thinking about the way that she really had to mobilize and get very active as a patient. And then there uh, are clusters of symptoms that travel together. If she's not sleeping and she's feeling alone and feeling really desperate and a tremendous amount of physical pain, it's not surprising that there are more severe symptoms that begin to show up. I think a lot of us can imagine or approximate being in that situation and beginning to have some thoughts of not wanting to be here, not wanting to be in that life, or maybe not a full suicidal thought of wanting to take your life, but not wanting to be here or in this situation anymore. And I think a lot of individuals experienced that strain of thoughts during the pandemic. The way that we disentangle it in mental health is by being thoughtful and careful and listening better than any other field of medicine, and trying to really be active listeners and then do something with that information, help individuals feel that they are within a framework. We might not have all the answers, may not have the answers today, but we have a next step, and that we're committed to be with individuals as they are restoring their mental health and restoring full clarity of their sense of who they are, all of their faculties, a sense of a stable mood, a sense of control over worry, and then also equipping them with tools. We also know that individuals who have chronic illnesses, there are going to be good days and there are going to be bad days. And if we can really do our best in mental health to acknowledge that and to help really destigmatize that mental health is not something that just 20% of the patients or people have out there in the world, that famous statistic 1 in 5, that mental health is really something that all of us need to cultivate within ourselves, within our families, and within our communities. And when we all get aligned with that, we're all committed to promoting mental health. That's when I think that we will really know we've defeated stigma, and when I think more patients are going to have access, and all of us will really be able to achieve our full potential.